Welcome to Inside Healthcare with CEO and President of MagnaCare, Joseph Berardo Jr. Today, he'll be discussing patient-centered medical homes. What is a patient-centered medical home?
A patient-centered medical home, accountable care organizations, all of the things that you might hear in the newspaper or hear talked about as it relates to health plans and the wave of the future, in many ways are not very different than some terms from the past. And essentially, a patient-centered medical home really is a provider organization, a provider office that gets involved proactively with managing the overall care of an individual member. So as an example, a patient-centered medical home that might provide care for a diabetic is very involved in monitoring kind of compliance related to the disease state and how that member treats themselves and takes care of their treatment plan. So for example, a diabetic should have their hemoglobin A1C tested every 6 months. A patient-centered medical home usually will have an electronic medical record or some other system of understanding and monitoring whether or not that patient has been in and what the time frames are. Not unlike a tickler system for the most part. But what happens is if they see that a member has a gap in care or is beginning to become non-compliant with a treatment pattern, the patient-centered medical home physician, nurse practitioner will reach out to the member, engage them in the discussion, and pull them into the system. So what I like about what's occurring in the marketplace, although I think a lot of the terms are misused, is that we're starting to understand that within the claims data, medical claims that are incurred, pharmacy data that is used in prescriptions, lab tests and lab values, all of this information is beginning to be used to understand what the disease state and what a treatment plan or gaps in care are for an individual member. The information is being shared with providers, and providers are then being asked to pull members into the system, meaning calling somebody and saying, let me schedule your mammography, calling somebody and saying, let me schedule your hemoglobin test. So really it comes down to primary care. And this country, for the most part, has spent way too much money on catastrophic care and not enough money on preventive care. And what you're seeing happening as a result of healthcare reform, although not dictated by it, is more of a focus on getting people the right care in the right setting at the right time. And that's really what a patient-centered medical home's mission is to do.
What patient-centered medical home services does MagnaCare offer?
The patient-centered medical home services offered by MagnaCare really are very unique because in many ways the way we've viewed our role in healthcare reform is an enabler and a service provider that connects all the aspects of healthcare. So rather than actually being a provider or being in a provider's office or actually operating clinics, what MagnaCare has done is it's invested a significant amount of time and money in technology that allows us to look at medical claims, pharmacy claims, lab and lab values, and that all gets put together and distilled into a story that allows us to see the risk that exists for an entire group, the risks that exist for an individual member, and for the most part allows us to be proactive in supporting the member in getting them the care they need at the right time, the right place, and the right setting. So for example, our system will tell us if somebody's eligible for a mammography or a PSA test or some other preventive screening that is age appropriate for them and whether or not they've had it, because we see the claims, we see the pharmacy data, we see the labs. And if they haven't gotten it and the plan is covering it, which most do, we reach out to the member's physician, and then the physician is tasked with reaching out to the member to bring them into the healthcare system and get the appropriate care at the appropriate time. The same thing happens for people with chronic illness. We might be able to see in the data that somebody has had an above average amount of emergency room admissions. And if that's the case, there's clearly something going on with the primary care being delivered to that member. And what our system, and it's called Evaluate, allows us to do is it enables us to get involved proactively with the patient's physician to understand what are the issues that this patient is facing. Does it have to do with their disease? Does it have to do with how they live? Are they trying to get to dialysis because they have kidney failure, but they live on a fourth floor walk up and they can't get there appropriately, and it's easier to take an ambulance. I mean, this sounds silly, but this occurs within our healthcare system, and it's an enormous waste of resources, and it's not the appropriate setting for the member. So what I like about the patient-centered medical home services provided by the MagnaCare Evaluate program is that it enables us to make sure that the member is getting the appropriate care at the appropriate time in the appropriate setting, which is good for the member. It's good for the financer of healthcare, which is usually their employer or a government agency, and in the end, it's good for the lifestyle of the entire membership and population being served.